Hi everybody, Kate here, one of our physical therapists at our East Norristown location, here to go over my best recommendations for lateral epicondylitis, and that's pain being on the outside of your elbow. Pain extending down a little bit into the forearm, a little bit up into the shoulder area, but really staying pretty local to the outside of the elbow. I'm bringing this up at this time of the year because talking to you gardeners out there who are playing out in your veggie perennial annual beds, mulching, edging, weeding, building new beautiful, rock walls for your gardens and everything, and just doing a lot of repetitive activity because it's so beautiful out. We all want to be outside, but we're just out there for hours. We have our weekends. I'm guilty of it as well. We're outside for 5+ hours playing in our gardens, not really paying attention to how much time has passed, and just putting a lot of stress on our bodies. Also talking to all of you pickleballers, tennis players, golfers. Again, it's beautiful out, so we all want to be outside doing all of these fun activities, but activities that require a lot of sort of fine manipulation to the wrists, to the elbows, that can be placing a lot of stress on these areas. And I'm sure there's some of you out there who are experiencing some increased pain in your elbows specifically. Now, the first thing with this type of issue, before moving too far into anything else, you want to make sure that this is truly the issue. There are other things like our shoulders, our necks, nerves that come out of our necks and down our arms that cause pain in our elbow. So just because you have elbow pain doesn't necessarily mean that's the actual source of the problem. So what I would recommend is, if you've been unsuccessfully treating your elbow with exercises and stretches and wearing counterforce braces and things like that, and nothing's helping, and it's been 3-4 weeks, you may be hitting the wrong source. It may not be your elbow, it may be something else. So in that instance, I would recommend go see a physical therapist and be appropriately evaluated to find what actually is the source of the problem, okay? Now, if you are listening to this and you haven't treated it yet and you're going, hey, I have elbow pain, try these exercises, give them 3 weeks or so. If no change, go see a PT. Otherwise, I hope they help. First exercise. So these muscles are overused, they're irritated, they get tight. And what happens is, where they attach to this bone on the outside of our elbow, they just start pulling. And then that bony area, everything above, below, inside, gets irritated. So the point of these 2 exercises is to reduce the tension that these muscles are placing on this area. So the first thing is digging, so soft tissue work. So you want to find the bone sticking out on the outside of your elbow. You want to go just below. And you're kind of looking for a place where you push and it's like, that's a painful spot, that's a productive spot. Those are the spots that you want to be focusing on. 5 to 15 seconds. And I'm just kind of pushing in, applying as much pressure as I can tolerate before I start sort of clenching up. 5-15 seconds. All right. Ow, 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 ow. All right. And then I can move down. Find another tender spot. Same thing, 5 to 15 seconds. You want to be finding 3 to 5 spots, spending 5 to 15 seconds a spot. You can move below that bony elbow spot. You could move above. You could move up. All right. Any of these points, if you find a tender spot, dig. Okay. So that's the first exercise. The second exercise is an isometric. Isometric strengthening is, we're trying to strengthen a muscle without actually moving that part of our body. So in this case, we don't really want to be moving too much because it's irritated, it's inflamed. So we don't want to be moving through full ranges of motion at this point. We're just trying to kind of calm it down. So this muscle that attaches to that bone up here extends our wrist. So we want to do wrist extension isometric. So I'm going to take my other hand and I'm going to resist. So I'm going to try and do that same extension, but this hand is resisting it. Okay, so what you can see up here is my muscle is contracting. I'm not really moving too much. Okay, 10 times, 5-second hold. You're really applying as much resistance as you can without any sort of crazy compensation. Okay, you're really trying to focus on just tightening up here. Okay, There's going to be pain, discomfort with exercise 1 and 2. That's okay, as long as when you stop, it goes away, or it goes away in like 10, 20 minutes, okay, that increased pain from that. What you're going to want to do is these exercises, as I just prescribed, 10 times, 5-second hold here, 3 to 5 spots, 5 to 15 seconds a piece. You're going to do that 2 to 3 times a day, all right? And what you're looking for is within 2 to 3 weeks, you feel everything sort of dial down. Your tolerance to activity improves, your baseline pain level gets a little bit less, okay? In addition to those 2 exercises, obvious activity modification, all right? So like if you're one of those pickleballers who are out on the court 5 days a week for 3 hours, maybe dial it down a little bit, 3 days a week, 2 hours a piece. Or if you're one of those who find yourself in the garden for like 7 hours on a Saturday, instead of going the straight 7 hours, maybe do 3 hours in the morning and be intentional with taking a break and then get back out there for your 3 hours at night. Just try and break it up and be mindful. Okay, I've been doing a lot of repetitive and prolonged things. Maybe let me just dial it down a little bit, okay? I hope these things help. If you have any questions, do not hesitate to reach out. Otherwise, good luck.